I mostly wanted to say good morning because it is always a good morning to be alive and to be here. And in these days of pandemics and challenging times, it is a reminder that what we hold most dear is our ability to wake up in the morning, get out of bed, and think about what our day is going to be like. I would just encourage you all that the best way to do that, you're going to hear, you know I keep saying it every time, the best way to do that is to stay home, keep your distance, wash your hands, don't touch your face. Do those things we encourage you to do, because that way you can keep waking up. Dana, how are things looking this morning?
They're good. They're good. I agree with you. It's good to be on this side and trying to get through another day and work through this pandemic, and it's one step at a time. Continue to wash your hands. I firmly believe that if you are washing your hands, and especially if you're in public, not touching your face, your risk of getting this disease is going to go exponentially down. So please remember that when you do have to travel for essential needs. If you can just avoid touching your face and doing frequent hand washing, you'll hopefully be much, much safer than not doing that.
You know, there's emerging evidence that the social distancing thing actually does work. There was an article I saw in the Washington Post last night that talked about a company that makes thermometers, and they were getting all these temperatures registers. You have to log in, so they're like 160,000 temperatures a day or some such number, and they were seeing less and less temperature spikes in the United States, and especially in those areas that are socially distant. So that's an interesting correlation that suggests maybe we've got some early evidence that suggests it is working.
That would be good.
It would be great. Rick Coldry is on my left. Rick, you talk to us a little bit about our lab and what's going on there, and then we're going to open up to some questions.
Yeah, no, I'd be happy to. So in our internal lab, about a week ago Monday actually, we were able to establish in-lab testing here at the hospital, which is a great benefit for our patients and our employees so that we could have more rapid turnaround time, inform our patients who had been exposed or infected with COVID, and also help take care of our employees and make sure that they were safe and quarantined if need be, and help stop the spread. So right now, we're able to do about 168 in-house tests per day. This week is an exciting week, though. We are going to be able to add about another 250 or so tests per day to our abilities by adding some additional equipment to the lab. And some of the equipment we're bringing in-house is going to have hopefully a lot faster turnaround time, so maybe as quick as 2 to 3 hours on some of the equipment. So that's pretty exciting.
It is exciting.
Yeah. Yeah. And then I don't know if we talked about this here or not, but there's some local business leaders here in Kansas City who worked really hard and brought forth a large effort to bring some testing capability to Kansas City. And we were fortunate enough to be able to work with them. And right now today in the lab, we have some visitors who are here from the company BGI, and they are helping us set up that equipment in a lab. And it's a great community effort. A little bit about that story. U.S. Engineering built stainless steel tables to put these 600-pound equipment on in 4 days. So custom manufactured that in 4 days. That arrived, so that was a great effort from them. And then North Point helped logistically to get the folks here, the engineers here, to set it up with a private charter plane to make sure everybody's safe and that no one was exposed in the travel process. And so we have a great team here today setting that stuff up. So hopefully in a week or a week and a half, we will have significantly increased capacity and figure out how.
When you say significant, how many is that?
So until we actually see it operate, we don't know. So the company says it can do up to 2,000 per day, but we'll have to wait and see. And the thing is, I got to point this out. I know you guys know this. One of the things to do the test is a swab. You know, it's a fun thing where we have this NP swab, nasopharyngeal.
I don't think it's fun. Have you ever had one?
No.
They are not fun. Go ahead.
Lean back,
Go very deep. Feel like you had a brain biopsy.
Yeah. And the problem is that there's a shortage of swabs. So the testing capacity is great, but without the swabs, we are very limited in the testing that we can do.
Do we have swabs for the new cool tool?
We have only about 1,000 swabs on hand right now.
Yeah.
So we have a lot of folks trying to source them for us. If anybody out there has a source of nasopharyngeal swabs, let me know. We're happy to get them from you.
And I guess Q-tips don't do the trick.
Well, according to Dr. Leisman in the micro lab, she's not fond of the Q-tip and not sure that it'll actually work. But it's a good
Yeah.
idea, though. Yeah.
You don't have to go to. I think you'd have to have a bit very long, like almost a
It would
fly
get
rod, to
stuck.
stick it in far enough. And otherwise, you're not gonna go very far. All right. Well, we're open to your questions, things that you might want to know, and maybe asking us things we don't know.
Dana, this is Bill Procedure. So, one quick question. A week into the stay-at-home directive, are you seeing any numbers from either of the state departments of health that give you either hope or concern? And anything you can tell the public that there's progress here?
Yes, on both sides. So, what we pay attention to is the number of patients we have here in our hospital. The lack of community-wide testing means we don't really have a great sense of how much COVID-19 is out in the community. And so as a result, we have to go by our number of hospitalized patients. And I don't think I said this a minute ago. We have 30 patients hospitalized as of last night. I don't know this morning's numbers yet. We had 30 patients hospitalized as of last night, and I believe 10 of those patients were on ventilators, and about half of them are in the ICU, and half of them are out on a routine floor. Mm-hmm. And we had about 20 patients here under investigation, which were all new tests because we turn around our tests pretty fast now, thanks to Rick and his team's efforts. So I think the key for us will be what happens in the next week. That will be the tale of the tape. We did social distancing 9 days ago, right? Or really, it started on Tuesday, so I guess 8 days ago. In the next week, we're going. My math is not always the best. In the next week, we're going to know how well it's working here in Kansas City, and that's going to give us a lot better sense of how this is going to go. We have models that say we're going to do just fine, and we'll take about half of our hospital beds with COVID-19 across the Kansas City metropolitan area, but we'll be okay with that. And we have models that show that we're going to exceed our capacity. We have to work toward both possibilities because we don't know yet until we have a better sense of the trend of what's going on around social distancing. What we do know is there's some cell phone data out there, and you can access this online. They look and find how closely together cell signals are. And by looking at that, they get a sense of whether or not people are practicing social distancing. And what they know is that in Johnson County, and it's about, I may not be right about these numbers, but in general, this is directionally correct. There's been about a 40 to 50% decrease in proximity. In Jackson County, there's been about a 35 or 40% decrease in proximity, and Wyandott's like that, 35 to 40%. You really want to hit a 50% decrease in density and really almost 70%, because if you can do that, we will bring the this is not a word, communicableness? We'll bring the ability. I want to see our signer do that one. Okay, communicableness. Let's say you do that. Or how well that, or how easy it is that virus to transmit from one person to another is that R naught. That's a fancy term. It's a statistical term, but how easy it is for the virus to go from one person to another one really goes down dramatically. And so that's going to be the key. I think the temperature sensing stuff is interesting, and we'll see if that plays out and gets verified by other organizations. But I think that's what we have right now, and I think we're going to be a whole lot smarter a week from now. Dana, any thoughts?
Yeah, I think I agree with you. If we can get to that 50 to 70% physical distancing, social distancing, on that one arm of the data with the cell phones, that's really going to help decrease that R naught, that infectivity or reproducibility number down to 1 or less, and that's when we can have a stop of the pandemic.
Next question.
Have you guys been following what's taking place in Houston with using antibodies and blood to possibly treat some critically ill patients? And is that something you guys are looking at?
Yeah, I can answer that. I mean, I think that is probably one of the more promising things. We've seen convalescent sera, basically meaning somebody who's infected and has survived. We've seen that work before for other diseases. I think that the trials are still fairly small. We definitely have our therapeutics group that's led by some of our ID physicians and our critical care physicians and our ID pharmacists working on that as well.
So you guys are looking at doing that based on what the trials show. Is that accurate?
No, it's currently in trials right now. We're looking at working with the trials if we're able to.
In other words, we'd like to become part of those trials. Hopefully I think we're relatively confident that will come to pass.
Yep.
And then, the FDA announced yesterday they're trying to speed these things through. They just gave this indication to hydroxychloroquine much earlier than they would normally do things. So I suspect if there's any evidence at all that this works, and I'm with you, I think if there's historical evidence in other diseases that it does work, I suspect that they'll put their foot on the gas and get this approved pretty rapidly.
Yeah, and it's not only the sera of surviving patients, but it's also what we call monoclonal antibody that they're looking at as well. That's one component of somebody who's survived, one particular antibody directed against the virus. So they're looking at those types of things as well.
And you pull it from different patients and then try and give it, because the monoclonal antibodies tend to be similar from patient to patient. And you just got to get rid of all the other antigens in the pooled sera and things that could cause trouble.
Yeah.
So.
How important, follow-up for that, then how important would it be to find people in the communities who maybe had mild cases and stayed at home and recovered? Would that be key down the road to expanding that treatment if it works?
Yeah, I think that's important. But if we can also develop a laboratory-engineered monoclonal antibody, and we have monoclonal antibodies for lots of things, including cancer treatments, things like that. So there are very different ways. There is definitely pooling of sera, of convalescent sera. There's also production of these monoclonal antibodies in the lab. There's just various ways that we can go about getting these types of things. But certainly, as we get further into this process and are able to detect people who have had evidence of the disease and have recovered, whether in the hospital or at home, certainly trying to pool convalescent sera is one thing that is being looked at right now, and we'd be interested in looking at that further on a trial sense as well.
It'll be years before that's a functionally available
Probably.
treatment, though.
But the pooled sera could be ready pretty rapidly.
Yeah. Through the collection process.
Yep. So I do think, there is logic to say, gosh, we want to know who those people are. We probably are going to have a pretty good volume of patients just based on the numbers that we already know are positive.
Hi, it's Taylor from Channel 41. Can you kind of describe the usage or expectations that people can expect with the new Abbott test that the president debuted yesterday during his press conference in the Rose Garden, that physical test that Abbott's come out with and its usage?
So what you guys don't know is internally, I look at Rick 2 or 3 times a day and say, come on, brother, how fast can we get this done? Let's go. Let's go. So Rick keeps looking at me like, just slow down. Stats.
Yeah, no, I'm with you. I want to go just as fast as you can. So I think that what you're talking about is the Abbott ID Now platform, the rapid test. And there's a couple issues with that. One is the information from Abbott is not particularly clear about how sensitive or how accurate that test will be. So that's a challenge. And it's very exciting. It's very sexy to say we can have an answer in 15 or 20 minutes. And
But if the answer's wrong,
or unclear, then it doesn't count. The other kind of issue with those devices are, and we looked into this, they're not available. We can't get them. Abbott is deploying them to the places that have the most cases, and they're only
as they should.
As they should, right? That's the right thing to do. And they're making about 50,000 cartridges a day, and so between the inaccessibility of the devices and the inability of the manufacturer to make enough cartridges, even if they were out there, it's not a feasible solution.
And the lack of knowledge of how sensitive it is. What we do know is that in our lab's hands with a good swab, and this is really important, you can tell your readers, our listeners, if somebody has done a nasopharyngeal swab for you and it didn't hurt or it didn't feel like a brain biopsy, then you didn't have a good sample. But things got to go back really far, and if you don't do it right, then it can have a false negative to it. And then, you say, oh, you don't have COVID-19. Well, wait a minute, then you're out infecting everybody. So what we're encouraged by is when we've done our testing, negatives, when we do repeat sometimes, negative is negative. That's what we found, and positive has been positive. So,
That's right.
We feel like our sensitivity and specificity in the right hand of the right person doing the swab, and again, you feel like you're getting a brain biopsy, then the data looks pretty good for the test.
Yeah, for sure. All of the results that we've tested in-house here at the hospital, it's been very clear. The term that our microbiology director uses is it's really hot. Like it's really clear that the virus is present or it isn't with the sensitivity level of the test we have.
I take it you don't really want to be hot. That's probably
I
the
think
goal.
it's a bad idea right now to
Yeah,
be hot.
that's
yeah.
what I would say too. How do you not be hot?
Yeah.
You stay
Say
away.
hi and wash your hands.
Wash your hands. Don't touch
Yeah,
your face.
social
Keep your
distancing.
distance 6
Yeah.
feet. Question.
Can you guys tell us a little bit about the collaboration across hospitals as a group, as a market in Kansas City? Anything new emerging there, or have you guys always worked together to have some sort of comprehensive plan for mass casualties or mass illness?
You know, well, we always have a plan, but having it as a reality is a much different story. And I will say to you that I think the pandemic, the SARS-CoV-2 pandemic, has helped forge new relationships across our city. I think KU and St. Luke's have probably talked more in the last 2 weeks than they have in the last 2 years. And you know what? There's a lot of good doctors. There's a lot of good hospitals. There's a lot of great care here in Kansas City. You know, I'm a KU guy. I think we're always the best. But there are great organizations out there. And what is rewarding in the midst of a crisis is to watch people pull together for a common good so we can do our best to try and take care of patients. That's what we're here to do. And I will say, I think that spirit of cooperation is alive and well. And in the last week, we hosted a teleconference, St. Luke's and KU did, for the chief medical officers of Western Missouri and all of Kansas. You know, prior to the pandemic, that would never have been true. And now it is true. And we're all trying to do the same thing. We're trying to pass along information that we think might be helpful to others and to plan for what a surge could look like and how those patients would be distributed. One of the keys to doing that going forward, though, is that we get all the data from every hospital so that we all know where the COVID-19 patients are, so that the ambulance drivers can make sure we're taking people to where beds are available. And to do that, one of the things that needs to happen, KHA, Kansas Hospital Association, is real good about sharing that data for every hospital so we all know. Missouri, we get it from kind of as a group, but we don't get it from individual hospitals. And that's a Missouri Hospital Association deal. And so we're trying to work with MHA to get that data out so that our ambulance drivers can know where the bed availability is in terms of COVID-19, the number of ICU beds, the number of ventilators, and things of that nature, so we make sure we're taking patients to a hospital where they can get the right care. So the hospitals are working together to see that that happens, and I think that that's a really great sign of how people are working together to save lives.
Yeah. I'll just add to that. We've already offered and agreed to do some inpatient testing for a couple of local hospitals. The commercial labs are overwhelmed with the number of tests, and so the turnaround time has been up to 3 to 5 days, which is really hard on an inpatient, and we're trying to
Well,
conserve
and it's hard
PPE.
because you use all your PPE
Right.
when people are in the rule-out status as a PUI as opposed to knowing if you have it or not. So we turn around in about 12 hours, I think.
Right, that's about 12 hours, right. So we've helped out. We're happy to do that. And we're sharing information across hospitals about testing capabilities as well. And so we're trying to make sure that the sickest patients who need the answers the fastest get them.
Do you have any updates on PPE availability and supplies and sourcing?
You know what? So yes, and I think most places in the area, I know KU at least, we're in pretty good shape at this moment. But remember, the reason we canceled surgeries, and everybody did this now, I think all the hospitals are doing it, and canceled ambulatory clinic visits, is in order to conserve PPE as well as to protect patients from traveling in public, especially ambulatory clinics. But really our goal is to conserve PPE. That way we would have it for the surge. So, you know, it's what I've said a couple of times. If we have an infection rate where we have 1 in 5 patients, that's about a 20% of the people get COVID-19, it's going to be hard. We're going to have way too many deaths, but we have enough beds, we have enough capacity, we have enough PPE. You push that up to 40% of our population or 50%, which is closer to where New York City is, we're going to struggle. And everybody's going to struggle. And we don't have that many beds. We don't have that much PPE. The other thing we're trying to do is with social distancing is to lower that down to 20% and spread it over a greater period of time. Because if we do that, again, there's enough beds, number one. And number two, supply chain can kick in. You know, the U.S. manufacturers are ramping up their production of PPE. The way that works is the more you spread that over time, the more of an opportunity that production kicks in, and the better we are at our ability to use it. So I think those are the things, again, those are just more reasons why we need to practice social distancing and stay at home. Next question.
This week, Johnson County Parks and Rec reopened some of their public golf courses. What would you make of that decision from a health perspective?
I'm not a golfer. I'm going to turn to Dan. I don't know if you
I'm
are.
not either, but I've been asked this, and I certainly saw it on the weekend when I was out walking that there were golf courses open. You know, I think there can be a safe way to do it. Again, you're outside, so that's good. If you can, you know, limit it to yourself or somebody with you who's maybe in your household, I think that's okay. If you're using your own equipment, your own ball, your own clubs, trying not to touch other things. But I think that's okay to do that, as long as, again, you're keeping with yourself. You're not in large groups. Obviously, if you're golfing, you're not going to be in large groups. Wiping down either the cart, the golf cart, or the pull cart, wiping that down. I think there's healthy ways to do that and ways to be safe when you're doing that. And I don't think that's too big of a deal, as long as in the clubhouse, you know, there aren't people congregating and things of that nature. Be smart and still adhere to the mandates of the county and the state.
And then there's some courses that said walk only, but no driving, as the carts can be a source unless somebody's out there wiping them down.
Yep.
And no flagpole, so you may not
Yep.
know where the hole is, because you don't have to grab that, and you want to wipe down the cups when you stick your hand in there to get the ball out and things of that nature. So
I heard some golf courses put a plastic block on the hole. If your ball
You
hit the
hit it,
plastic block, you're
that you guys-
good. And
I
so
like
there's
it.
nothing
Yeah,
to
that's-
touch.
okay, I would need
Yeah.
a very large plastic block.
Me too.
Okay, next question.
Jessica McMaster,
I know
41
Jessica.
News. Go ahead.
No, you go, Jessica. I've already asked the question.
Okay, no problem. Speaking to the, stores being open, we know hardware stores and things like that are considered essential because certainly there are things that can go wrong in the home, but we're getting a lot of feedback that people are going there for their gardening and plants and things of that nature. Can you speak to that a little bit?
Yeah, I'm glad Dana's here.
Yeah,
Dana, are you a
I don't-
gardener?
I wish I could. I don't have a green thumb, and I'd rather be doing other things outside. But I think yard work is great. I don't know, again, that there's a problem with it. I don't think there's a lot of, risk essentially with plants and things of that nature and organic things. I don't think the virus would last very long on environmental surfaces like that and out in the environment. And if that was your question, I don't know what other.
Yeah. Because one of the things,
I mean,
here's
in terms of going in-
here's what I heard. So this is a story. One of the folks I work with very closely was telling a story of trying to go to Suburban Lawn and Garden because they're going to say, okay, I'm stuck at home, I can't do a lot, and so let's fix our yard up. So I think everybody in Kansas City had the same decision, and they all went to Suburban Lawn and Garden, or whichever one it was. It could have been another one. I don't care. They went there, and the problem is that there was a big crowd there,
too many people.
and people all jammed together. And some people were out there, and some of the employees were even uncomfortable because nobody would maintain their social distance. And some people were saying, "Oh, it's a hoax anyway. It's not real. We're all fine." And that's the problem.
That's the issue.
It's not that you want to go do gardening. It's that when you go into the store to get it, you're too darn crowded. So, if we're going to practice social responsibility, you're going to have to do it and go to the store in a way that keeps people safe. You can go to the lawn and garden store. That's okay. I get it. You want to go outside and do some gardening. Makes total sense. But by gosh, have some way that there's a line, that people are 6 feet apart. You're not all in the store at the same time, and you practice respectful social distancing. That's how we keep people safe. Asking people if they want to garden, sure, go right ahead. As Dana said, digging in the dirt, that's a great thing. But the real issue is that when you go get stuff, you got to do it in the right way. And quite honestly, the stores have got to help you. I saw another question that popped up over the weekend about Bass Pro Shop. Should they be open or closed? Well, I'm a fisherman. I think fishing is great. Can you go out there and do it in a solitary nature and stand out in nature and cast a line? Go for it. But if you're going to go to the Bass Pro Shop, then get a line, practice social distancing and don't all crowd in there together. And I think we can do things like that that are safe, but we have to do them thoughtfully and intelligently.
Yeah.
I mean, I think you just don't know who came before you, 5 minutes, 10 minutes. Was that person ill? Were they looking at a fishing pole? Were they looking at gardening tools? Were they, sick? And so that's where the real danger comes in as well.
If you're going to pick something up, you better have your wipes that you can wipe stuff down with. And I guess somebody could question whether or not Bass Pro is essential or unessential. So.
I think it'd be good.
I have a question about face masks because it does seem like some of the advice is evolving with that. If someone is making a cloth mask, because it's possible the CDC is going to advise people to maybe wear a cloth mask, but they don't want them using what hospitals would use because that would affect the supply chain. For people at home that are trying to cobble together a cloth face mask, what do they need to be thinking about as they're creating these home face masks?
I need a blue one. No, the CDC it was reported yesterday that the CDC is considering recommending that people wear face masks in public, not because it protects you from others, but it may help protect others from you. Because if you cough or sneeze, then some of your fomite, some of that mucousy stuff gets trapped in your mask. Now, I'm going to turn to Dane to give you the science side here in just a moment. Kind of questionable about whether or not cloth face masks really do any good, or if it's worse because then you start touching it and then you touch everything and it just gets to be a mess. The reality is that if you practice social distancing, you're going to be okay. And that's, we come back to that, and folks try to find ways to not do it, but that's really not the right answer. So let's Dana, give us the science behind face masks as a way of me. If I had a face mask on, am I somehow protecting you from my mucus?
I think if you're wearing a biomedical grade face mask, then yeah, certainly you're probably protecting me or somebody else from your droplets, probably bacteria. We have to remember these viral particles are extremely small, and going through a piece of cloth is nothing. It's like going through a sieve for these types of things. So it's unclear whether it's going to help, certainly if you're not sick. But if you're sick, it could help spread some of those large droplets if you're coughing or sneezing or things of that nature. And again, if you're making them at home, you probably also want to make sure you're not making it too tight and suffocating yourself as well.
Yeah.
So that's
the other thing is, though, and you've talked about this, is when I go, I've kept my hands really clean, but I go adjust my mask or I touch it, and then I touch something else, and all of a sudden I spread everything because my mask is holding all those germs. And biologic masks are just made a lot differently than that. They're made of a different material. They have a different filtering ability. They're just a lot different. So I suppose a cloth mask may offer minimal protection when you're out there and you're sick and you're trying to prevent your mucus from getting away from you. But you better make sure you wash your hands every time you touch the mask.
I apologize if this was already asked. I got on the call a little late. Dr. Hawkinson, I know you spoke with us at 41 News earlier this morning a little bit about eating out.
Yeah.
But I was questioning because a lot of people have been asking, is that safe? Because you don't know who's preparing your food. You don't know if they've sneezed on it. Can you elaborate on that a little more?
Yeah,
because I like to go out once a week. So let's hear your story, buddy.
I mean, the best thing that we can say is that it's certainly happening a lot. There is a lot of takeout. You would hope somebody is not necessarily coughing and sneezing on your food. We don't think and really expect that the virus would survive very long if that particular scenario occurred. Certainly there's more of a concern of the containers, whether it's plastic container or cardboard container. That could be a concern. So there's various ways that you can do that to stay safe. Some people are having the delivery driver drop it off on the porch, and they take it out of the bag, or they're leaving the bag on the porch and taking the specific containers in, wiping down the containers. You also more than welcome to put the food itself on your own plate or your own bowl. But I think the last thing we need to do then is wash your hands prior to eating and picking up a clean piece of silverware. And doing all those things and taking that abundance of caution is probably going to be the best thing. It's really unclear that there's going to be transfer from someone who if the delivery driver is sick. if you're doing all those things, you should be as safe as you can be at that point.
I mean, even when you go to the grocery store, people have touched the things in front of
Yeah.
you, so then you bring them home, you wipe them down, you wash them off as best you can with water.
Mhm.
Not so much soap and water, as it turns out. The CDC is not as wild about soap and water
On the
because
vegetable,
it does
yeah.
all sorts of funny things. Then you start eating a lot of soap, and soap, as it turns out, is not meant to be a food source.
No.
So, next question. All right. Well, not hearing other questions, we'll kind of wrap up here this morning. Let me just turn to my folks and ask them if they have any other thoughts. Rick, anything that you, as you look down, stare down this challenging time, any other thoughts you would like to leave our audience with?
I would just say I think it's really hard, and you have to be aware, or we all need to be aware that this is scary and uncertain for everyone, and just looking out for each other, giving people a little bit more grace and patience, and doing everything we can to stick together and support each other, along with social distancing. I think is maybe a priority. I heard that today.
I think it might be. Dana?
Yeah, we're taking it one day at a time. We're continuing to look into new therapeutics, such as we talked about with the convalescent serum, the monoclonal antibodies. Hoping we can get testing ramped up to really get a good idea of how many people have been infected and the prevalence of it in our region, and just work one day at a time and try to get all that information.
Missouri's a show me state. Show me. Let's do this. We can do it together. In Kansas, there's no place like home. Good combination, folks. We'll see you tomorrow morning. Thank you.